Good morning. Today we're going to be talking about constipation, from bowel blues to relief. And it's interesting because most people are not aware that December is actually Constipation Awareness Month. Most people don't know that. But we'll be talking about it because it affects so many people. Thank you, Dr. Ozuomba and Sherese, for coming on the program with us today. It's a pleasure to have both of you here with us.
Thank you very much. The pleasure is mine too.
Thank you. So, Dr. Ozuomba, if I could start with you, you're a general physician. If you can tell us about constipation, but first, is it something you see or encounter very commonly in your practice?
Well, thank you so much. To start with, I'm a family physician. That's different from a general physician, kind of. The family physician is somebody that has gone through the training to become a specialist generalist, So that is by the way. Constipation is common, but you may not see that so much coming to the hospital to present because people look at it as part of normal living, But in some cases, you see them presenting to the hospital when they feel that it is beyond what they can cope with.
Okay, so exactly what is constipation? How do we medically define it?
Well, before constipation in simple terms means that the frequency of stooling is reduced, less than what is usual for the individual, or the consistency of the stool is higher than what is normal for the individual. So generally we say if somebody passes less than 3 times per week, that is low. But if it is so hard, that is also a part of problem. So we are talking about the frequency and the consistency of the stool in this matter.
So why does it occur commonly?
Well, generally, there are different reasons why it occurs, but the simplest thing is that usually by the time you eat food, it goes through digestion, a lot of water is taken out of it, despite the fact that even no matter the amount of water that is removed, that still about 70% or thereabout of the content of the stool is still water. So by the time much is taken away from this, the waste product, it becomes so hard. So one of the major things is not taking enough water and not taking enough type of food that will help the person to move the bowel.
Yes, thank you. Talking about the kind of food, it's a good thing we have Sherese, our nutritionist, here with us. We'll be talking to her about it soon. But what kind of symptoms should worry a person? Because sometimes some people say, I'm always constipated. Ever since I was young, I my own stool frequency is not what your own stool frequency. Some people go every day. Some people go twice a day. Some people, they go, once in 3 days, as you said, but that once in 3 days may be their own normal. So how would you say that, this constipation is serious or this constipation is not serious? This is the one that you can handle at home. This is the one you should come to hospital with, even just as pure constipation.
Yeah, thank you so much. As you rightly said, it is individualized. It is not the same for everybody. Some people go once daily. Some people go 3 times daily. So once it is different from what you are used to, yes, you now think that look, something is wrong. So, but generally, by the time it's associated with abdominal pain, and there is blood in the stool, and vomiting, I mean, those are red flags that you need to go to the hospital because it may be more than what you think you may explain away as normal with you. So that the doctor will put you through examinations and conduct some investigations to ensure that there is nothing ominous happening in the person.
So what you're talking about is really quite alarming, but would you say that constipation is common in some people more than others?
Generally, we're talking about the prevalence. That is what I believe you're talking about here. That is, the older you become, the higher the chances of being constipated. And, women are also good. So because of hormonal changes too, it occurs more in females than males. And occurs more in pregnancy because of hormonal changes as well. So those are the few things I can just call up now, as things that can make constipation more prevalent. Age, you said, the older you are, the higher the chances of being constipated. More in females, in pregnancy, one is likely going to have it. It occurs more. And again, if somebody is on certain drugs, the chances of having it is also higher.
Okay, so medications, because that's what I was just going to ask, because you've already spoken about dehydration. If you don't take enough fluids, you can get constipated.
Yes.
If you take certain drugs, you can get out. What about things like stress? What about things like inactivity? Do they have any impact on our bowels at all?
Well, generally, we talk about, sedentary lifestyle, physical inactivity as major contributors. But when you talk about stress can just cause anything you can think of. It is a no-no anytime, so it can cause a lot of hormonal changes. It can cause a lot of, psychological issues for the person and all that. So, I mean, one cannot rule out stress as a cause of constipation or cause of anything, almost, I can say. But by the time you exercise, there's a lot of things happen, including the release of, the pleasure hormones, the endorphins and all that. And, so stress is something that can be considered, really. But generally, you should look at other things before you now, visit everything on stress.
So now, when you've talked about the things that cause constipation, you talked about some of the common symptoms that you have with constipation. What are the kind of over-the-counter treatments that people normally use? And then, do any risks come with them?
I didn't get the last part.
Do any risks come with them? What are the common, okay, let's just talk about the common things people commonly use in our own environment.
Well, generally, the first thing anybody would advise is lifestyle, which I'm sure the dietitian is going to be on, especially the dietary aspect of it, but people generally we go to the chemist to go and buy laxatives and all that, so about the issue is this, some of these things, if you use them so readily without going to see the doctor, you might be delaying the diagnosis of something that may be serious, and if you use the ones that make you go to toilet so often, not necessarily a formed one. The one that makes you formed one is not too bad, but the one that will now make the much more watery and you are passing frequently, somebody can now have a electrolyte imbalance, and you will now have a vicious cycle of relief and forming constipation again. Because as we all know, that most of the water is absorbed from the excreta before it goes out. And the longer it stays, the more the water is withdrawn and it becomes harder. It can be so hard. So by the time you are using some of these things that make you to, go to toilet frequently, passing both well-formed and not well-formed stool, those, electrolytes are lost, more water is lost, and the body now will become in need of more water. So they're going to withdraw more from the next one you are eating. So you are now going back to where you started from again. And you may not be tied in that vicious cycle of constipation, taking something to relieve it, and going back to constipation again.
Now, you've talked about something very interesting, and earlier on you alluded to it when you spoke about, people just taking medications and then also not recognizing more serious bowel conditions. Obviously, you were talking about things like, bowel cancer. We're talking about things like when you're talking about pain, obstruction, and how about things like, how do you distinguish? Because I think this is the important thing that people want to know. They're listening now and they're thinking, how do you distinguish between conditions like irritable bowel syndrome, like constipation that comes with cancer, like constipation that comes with things like the obstruction and acute abdomen?
Thank you so much for the question. It is very important to understand when there are ominous signs in constipation, and not to, just think that it's one of the normal one that one is used to. When somebody starts having pain, abdominal pain, somebody having bloating, just like the tummy is getting bigger than what it used to be, and noticing blood in the stool, those are not good signs. When somebody starts noticing there is weight loss, that may be a suggestion that there could be a malignancy somewhere. When I say malignancy, I mean cancer generally. Here we are talking about colon cancer and the rest. So when somebody is also vomiting with the constipation, and all right, with the constipation, you just know that there is some obstruction going on somewhere. And again, by the time you notice that the stool may not necessarily be so hard, or yes, before I go on, may have constipation alternating with diarrhea. That is not a good sign. And again, when the stool that is coming out is just like a rat tail, it shows that there is some narrowing, a significant narrowing somewhere. So one needs to get to the hospital when some of these things happen, and not to just explain them away as a normal constipation.
Thank you very much. Thank you, Sherese. It's always a pleasure to have you on the program. Now, constipation is obviously, chronic condition. So many people have it. And we've talked about it. But can you how much does the diet influence constipation?
Thank you. Good morning, everyone. Thank you, Dr. Pamela. Constipation and diet are heavily connected. So diet influences this constipation a great deal. So this means hydration, fiber that one is eating, movement. It affects it a great deal.
Now, can you explain the difference between soluble and insoluble fiber? And how each, let's talk about fiber, okay? Because as a whole, what is fiber? Why is some soluble, some insoluble? And how does it affect and support bowel health?
Yeah, so thank you for that. Fiber is what we're getting from our fruits, our vegetable, just the bulk of what's being digested. And the difference between soluble and insoluble is that the soluble dissolves into a gel-like substance, whereas the insoluble is just adding bulk and speed to the bowel movement, helping things push along the tract easily.
Now, when you talk about those, you've talked about them specifically, but I want you to talk about it in the context of bowel health. What does it mean to you as a dietitian, as a nutritionist, to have a healthy bowel? I mean, the bowel for many is actually the brain of the body. Some people say the brain is in the head. Other people say the brain is in the gut. So, what does it mean to have a healthy bowel? And what kind of food should people eat more of to have this? Because I don't want just to focus on constipation alone, but just to talk about how to have a healthy bowel.
All right, thank you for that question. So the alimentary canal starts from the mouth all the way down to the anus. And so the digestion starts within the mouth. As you're chewing your food, you're masticating your food. It goes down, and the nutrients that are taken are used for energy, used for making vitamins. And then, of course, there's further breakdown and fermentation that occurs in the small intestines. And whatever is not used by the body is called waste. And so that waste elimination is excreted through the large intestines. So that's basically how food and nourishment is absorbed and building blocks for the body. Of course, eating the right foods is key.
So you were telling us about how the kinds of food we should eat. You also explained to us that fruits and things are what are good for us to maintain that healthy bowel habit, the healthy bowel, as opposed to having constipation. And you were mentioning about, you talk to us about fruits in season.
Absolutely. So those foods that help make the bowel soft and easier to pass, those are called the soluble fiber. And that's things like okra, your beans, your lentils, your sweet potatoes. Sweet potatoes, of course, you have the white sweet potato, you have the orange flesh sweet potato, you have the purple flesh sweet potato, and all of these are grown in Nigeria. You also have the fruits in season, the mangoes, the pawpaw, the watermelon, the avocado, the guava. And one that's coming in season very soon is agbalumo. So these add a lot of bulk and fiber to your to the stool and helps it to move faster and eliminate faster. And when we look at the insoluble fiber, those that really increase the bulk, I mentioned the agbalumo, there's all the leafy vegetables, our soups, the ewedu, water leaf, spinach, cabbage, carrots, cucumber, all of these help to add bulk and push for the stools to eliminate out the system.
Now, some people say that there's a lot of toxins in the body that are also eliminated via the stools. And when you have your constipation and it builds up in your body and causes a lot of problems, what do you have to say about that?
This is very true. And in order to alleviate these toxins building up, you have to hydrate well. And hydration is with lots of water. So ideally, you're to take 2 to 3 liters of water a day in order to help this stool and all these toxins pass through the body quickly.
Now, in Nigeria, do we have any foods that worsen constipation, our own traditional foods at all?
We do. If you're eating a lot of sugary foods, processed foods, this could look like biscuits, sweets, carbonated drinks, lots of floury products, pastries, bread, even rice. So if you're not eating our local rice and you're eating a lot of imported white bleached rice, that can also back your system up, causing constipation.
Now, some people ask the question, you always say eat oranges, but people, why should, so they say, oh yes, I drink a lot of juice. So can you tell us the difference between, in terms of value to the individual, from fruit juice in a carton, fruit juice, squeezed juice, and perhaps orange, let's just take orange. And also the eating of an orange fresh. What's the value in all three of them?
Well, I will say that eating whole foods is most valuable because once you get into making a juice, the juice is great if it's the natural juice from that fruit. It is good. However, you've taken out the fiber from the juice. If it is the carton juice, that's something that has to be preserved. Additives are put there in order to make it okay for shelf life. And then you have this smoothie where people blend both the juice and the fiber together. We say that's okay, but don't rely heavily on a smoothie. Otherwise, sometimes you can take in too much of that fruit, which could possibly cause concentration in the blood sugar levels. So just do things in moderation and be guided. But the whole fruit is absolutely better for you.
Now, what role do probiotics and fermented foods play in improving bowel function?
Okay, so the probiotics basically introduce beneficial bacteria to the body. So probiotics are things such as your yogurt, your kunu, fermented foods like your ogiri, iru, even your obono. These are all good probiotics, good beneficial bacteria that feeds the gut health. And then there is the prebiotics that also feeds the good microbes in the gut. So the prebiotics are those fibers, resistant fibers like banana, garlic, onions, even unripe plantain, cocoa yam. These actually are good for feeding the good bacteria as well.
Now, we don't have much time, but for people with busy lives and poor eating habits, they've identified from this, what kind of simple, very simple and practical dietary adjustments can they make?
I would say just being intentional, sticking to the 5-a-day rule, taking some pawpaw with you, some oranges with you to work, maybe in a container, something that's easy to carry, tangerines. Just make sure you get at least 3 to 5 fruit and vegetable in daily. And once you're intentional about this and drinking your water 2 to 3 liters for the day, you will definitely embark on having daily bowel movements.
And what's your advice for parents dealing with constipation in children related to picky eating? Because it's very difficult. It's easy as an adult to be intentional, but sometimes you have children that just won't eat the right things. How do you help them manage?
Yeah, so we encourage parents to eat with their children, monitor them on a meal plan just to ensure that they're getting all the fiber they need. Children need about 30 grams of fiber daily. So monitoring and encouraging them as much as possible, sitting down and eating with them actually helps.
Wow, thank you so much. I think if I can pop back to Dr. Ozuomba. Dr. Ozuomba, why is constipation often ignored until it becomes severe? And how can we change public perception, i.e. make them come to the hospital earlier?
Well, thank you so much. But as we said, that the bowel habit is individualized. Some people go 3 times a day, some go once, some in a day, some go once in 3 days and all that. So once there is a change, some of them will just explain it away. You know, it is what I ate, because of this, it may be stress, it may whatever. So they may not readily go to hospital because they believe it is not something serious. But as we said, that whenever there is a change in what is normal with you, that the person should go to the hospital, or when there is blood, when there is pain, vomiting and all that, they should go. But what I will advise is that maintaining a good bowel habit is very, very important. That not like when you are pressed, you say, let me go to so and so place before I now go to ease myself. That keeps the waste in the system for a longer time and allowing for more water to be withdrawn from it, and it becomes stronger. So some will must have trained themselves in such a way that if when they go to brush their teeth, the next thing is to go to toilet and bath. So and that is a good one for them. So such people, if for any reason they delay going to bath, they may not go to toilet because their body have been trained that way. So some other people, when they go to an environment they are not used to, they may not go to toilet at all. So those are not real sicknesses. It's just a question of how somebody has trained his own system. So, but once you start noticing that, that is a deviation from what is normal with you, one should go to the hospital. One should go to the hospital.
Thank you so much. So, Sherese, do you have any last words for our listeners?
Yes, I will say, don't delay in going to the toilet. Don't ignore those signs. Once you need to go, try and get your bowels moving regularly and eat your 5 a day.
Thank you. What final message would you like listeners to remember about preventing constipation?
Okay, Drink your water, 2 to 3 liters of water, and also move. Movement is key. This will help your bowels.
Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.